Relax or refractive lenticle extraction is an all-new femtosecond laser procedure for the correction of myopia and myopic astigmatism. Relax has few reported complications, one of which is suction loss. This video will demonstrate that excellent clinical outcomes can be achieved even in suction loss. Let us begin by looking at what is considered an excellent outcome and then quickly look at two cases of suction loss, how the clinical outcomes are different compared to the ideal case. This is one of our earliest cases of Relax, a -10 diopter myope who achieved 6/6 vision on the first day after surgery with excellent centration and uniformity on topography. Now let us look at a first case of suction loss, a middle-aged high myope with a normal topography and adequate pachymetry. Looking at his surgical video, we can see good applanation and centration. The lenticule cut has begun and is going smoothly. Shortly, it will reach the center, the blinking light disappears and the lenticule side cut will now be completed. From the appearance of bubbles in the periphery, which suggests subtle eye movements, this seems to be getting worse, but the cap cut continues. His movements are becoming even more and the cap is getting decentered, but the cap still overlaps the lenticule. Just before the end, suction loss occurred, but after the cap side cut is nearly complete. The cap is decentered but included the lenticule. As you can see, the cap was easy to identify and could be dissected, albeit with a little difficulty towards the left. Now the lenticule dissection has begun and proceeds with relative ease. To ensure complete dissection, and that is the end of the procedure. So 6/6 uncorrected vision was achieved on the first day after surgery and the topography difference map shows a very well centered and uniform pattern. To summarize, if the lenticule is well centered and the cap includes the lenticule, you can complete Relax with excellent visual, topographic and refractive outcomes. Now let us look at the second case, a 26-year-old high myope with mild astigmatism, normal topography and adequate pachymetry. As you can see, the lenticule cut is proceeding smoothly. It's reached the center now and the side cut is complete, but the appearance of bubbles in the periphery suggests impending suction loss. The bubbles are increasing but the cut is continued and is nearly complete. But now suction loss has occurred before the side cut is made. So the suction is carefully re-engaged and the cap cut and the side cut are completed uneventfully. However, accidentally, the lenticule got stuck to the cap and was very difficult to identify. But with patience, the lenticule could be identified and was carefully peeled off from the cap with largely blunt dissection, going all the way out in the periphery to ensure as complete a removal as possible. As you can see, in some areas, especially in the lower temporal quadrant, it's quite adherent in a few areas. But with careful blunt dissection and as you will see shortly, peeling with forceps. You can ensure complete removal of the lenticule. Of course, the surgery time in this does get prolonged. You can see gently the last bit of the lenticule which is stuck is being peeled off. Till the final tags are completely removed. As you can see, the uncorrected vision was 6/12 on the first day with some corneal haze. But at 1 month, the final visual outcome was 6/6 plus uncorrected with a uniform and well-centered topography pattern, similar to the earlier two cases. Therefore, in suction loss, do not panic. If the lenticule is stuck, do not panic. With patience, you can remove the lenticule completely. Visual recovery may be delayed, but the final visual outcome is excellent. So, in summary, complications can occur even in an all femtosecond laser procedure such as RELEX. However, the safety is excellent even in eventful surgery, as is seen in these two cases. This is an excellent option for nervous patients because visually relevant steps are complete in the first 30 seconds. In eventful surgery, do not panic because with proper understanding and application of surgical principles, excellent clinical outcomes can be achieved similar to uneventful cases.